Hi everyone. In today's clip, I will talk a little bit about sleep apnea. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. Sleep apnea is a sleep disorder that causes brief pauses in breathing during sleep. It can lead to poor ventilation and disrupted sleep. The most common type of sleep apnea is obstructive sleep apnea or OSA, which happens when the soft tissue in the back of the throat relaxes and blocks the airway. Symptoms of sleep apnea include loud snoring with a dry mouth or sore throat, daytime sleepiness, restless sleep, morning headaches, or trouble concentrating. Sleep apnea can be dangerous and lead to serious implications like heart damage and heart failure, arrhythmias, especially arterial fibrillation, and sudden cardiac arrest. Now, some factors that can increase the risk of sleep apnea include things like being a male, being overweight or having gone through menopause, using alcohol, sedatives, or tranquilizers, smoking, having nasal congestion, having medical conditions like congestive heart failure, high blood pressure, or type 2 diabetes. This condition is different from regular or primary snoring. Primary snoring may be caused by nose or throat conditions, and the sleep cycle, especially back sleeping or being overweight or using alcohol or other depressants, while snoring happens when tissues in the back of the throat vibrate, and people with sleep apnea tend to snore much louder than those with regular snoring and pause over 10 seconds while they breathe. And they take shallow breaths, they gasp, or sometimes they even may choke. And they may be restless during the sleep. Sleep apnea itself isn't thought to be fatal, but it has risks attached to it. Conventional medicine looks into CPAP machines, tonsil and adenoid removal in children, MADs, oral appliance therapy, and precision medicine. In orthomolecular medicine, we look into high-dose vitamin C therapy, magnesium glycinate, and niacin, and there are also several lifestyle changes that can help relieve sleep apnea, such as weight reduction, even in small amounts for heavier set individuals, regular exercise, avoiding alcohol, and sedatives, because sedatives relax the muscles in the back of the throat, which can interfere with breathing. Sleeping on your side, not abdomen. I don't recommend sleeping on abdomen because lying face down can constrict blood flow and make your heart work harder, as well as it can twist your spine and put pressure on the lungs. Also, if you have had a heart attack or heart surgery, sleeping on your back or right side can help reduce pressure on the chest and the heart. Sleeping on the right side is also recommended if a person is at risk for or have experienced congestive heart failure. Treating allergies that make breathing difficult by boosting the immune system is a good step forward as well. Taking honey to soothe the throat and decrease any swelling, and I mean natural honey is what I mean, and increasing magnesium intake and acupuncture are all very effective. On the Ayurvedic side of medicine, they recommend ashwagandha. This is an excellent adaptogen that calms the nerves, mitigates stress, and guarantees smooth transmission of signals all along the body to help breathe deeply. In addition, it is filled with phytonutrients, which induce undisturbed sleep at night to efficiently sort of combat sleep apnea and improve the quality of rest. Now take note that there is an interaction between this herb with other medications, with some medications, including those for diabetes or high blood pressure, medicines that decrease the immune system response or immunosuppressants, sedatives, anti-seizure medications or anticonvulsants, and thyroid hormone medications. The other herb is Shankapushpi. Is a potent herb that boosts brain power and is very useful in soothing pounding headaches and agitated moods that are often experienced in instances of sleep apnea. Being a mind-stimulating plant, it heals mental fatigue, elevates nervous system activity, ensures sound sleep, and vastly improves productivity, concentration, and memory. But again, Shankapushpi does have a mild blood pressure lowering effect. So people suffering from low blood pressure or those taking antihypertensive and anti-seizure medications should need to consult their healthcare provider before taking this. The other herb that they recommend is sarpaganda, which has tranquilizing compounds, and it is a time-tested remedy to enhance the quality and quantity of sleep, as well as treat heart-related conditions which are encountered in apnea. This plant contains strong antioxidants that relaxes the blood vessels, facilitates optimal circulation of blood, oxygen and nutrients to the tissue and organs, and brings down high blood pressure. But taking sarpaganda with anticoagulants or antiplatelet drugs can increase the risk of bruising and bleeding. Also, interactions with diabetes medications can result in dangerously low sugar levels, while interactions with tricyclic antidepressants can alter their effects as well. The next herb that they recommend, which is Jatamansi, this holds extraordinary potential in stimulating sleep, deep sleep at night, and it balances the body. It diminishes stress and tension in the nervous system, and I have not seen any drug interactions related issues with this particular herb. Then they have Nirgundi. This has gained a name for itself as a panacea for all ailments. Nirgundi is a versatile herb containing a powerful essential oil that tremendously uplifts breathing functions and lung power. Pouring like just 2 drops of Nirgundi oil into the nostrils and inhaling the aroma before bedtime prevents frequent snoring and enhances uninterrupted sleep cycle. Nirgundi may enhance the effects of anti-diabetic medication, leading to hypoglycemia. Also, it increases the risk of bleeding if the individual is on anticoagulants or antiplatelet drugs. It interacts with hormonal medications, potentially altering hormonal levels due to the estrogenic activity of this herb. Of course, there are many other herbs, the ones that I mentioned being the most publicized. I find the orthomolecular side of treatments less worrisome, vitamin C, magnesium glycinate, and niacin. Nonetheless, I don't recommend anyone doing any of this without proper supervision. On the metaphysical and spiritual level and emotional side of this ailment, with sleep apnea, one or more of the following is common. For example, the individual has a strong need to take control of their life, which even carries on while they're asleep. Sleep apnea also reflects deep distrust of family, which originated in childhood, and due to the dysfunctional family, they feel that they always need to take the reins. Also, not letting go of anger and resentment, and the individuals usually not only do not allow love to flow through their life, they may also avoid receiving love for fear that it will be accompanied by obligations and conditions. Fear of taking on more obligations and responsibilities also is one of the causes. An unconscious search for an exit from circumstances, relationships, or the future is another thing. And feeling unsafe in present position in life or suppressed emotions. So like everything in life, we create our negative life experience physically, emotionally because of our unresolved emotional challenges. We cannot ignore what is bothering us emotionally. The emotions need a satisfactory resolution, and when we try to ignore our emotional needs, they take root in the body and manifest physically, and in this case as sleep apnea. By addressing and safely releasing the metaphysical or spiritual causes of sleep apnea, there's no longer need to experience it. Remember, first comes the emotion, then comes the condition. So it is wise to clear emotional buildup to heal yourself. Hope this has been of some help. Like and follow for more. Be the light.